We heard a lot about the fight over health care insurance premiums during the government shutdown, and we're keeping a close eye on those costs. The Center on Budget and Policy Priorities reports that around 93% of Marketplace enrollees receive premium tax credits to afford their health insurance plans. But those credits might be disappearing, leaving these enrollees to pay more premiums, more than double the normal rates. So insurance expert John Woods, he's joining us here now with the latest on the policies, how they work. Thank you for being here to break it all down.
Thank you, Lindsay. Happy to help.
Yes, so with the premiums increasing and the coverage in some cases getting reduced, how are individuals and small businesses impacted by this? What are you noticing?
Well, I'll start on the business side. This year, for our January 1st renewals, the average is probably around 8%, but it's 8% on top of 7.5%, on top of 7%, on top of 7.5% year after year. So we are seeing some the cumulative effect, let's call it, of those types of increases. So employers, as you would expect, are looking at higher deductibles, more employee contribution, that sort of thing. And at some point, it's going to break. It's just, I have employers, I just don't understand how they can afford to spend that much money on health insurance for their employees. In the individual market, how do I want to describe it? What they've done is they haven't continued the extension of the subsidies. So during COVID, the Biden administration made the subsidies to a broader group of people. So they're cutting that back to the original 400% of poverty. So I can give you one quick example. Lady I talked to last week, she's 63, she's turning 64. Last year, she picked a bronze plan. So it is absolutely catastrophic coverage. She pays the first $8,700 out of pocket for any of her medical expenses this year. Next year, her same plan goes to $9,100, and her premium goes from $0 to $492.
Wow. So, John, what options do people have then to deal with these increasing costs on the personal end and the business end?
Well, on the personal end, something that we've actually talked about for many years, and I will say up front, it does not fit everyone, is the healthcare sharing ministries. Some of those programs are very solid, and they work pretty well. I had myself and my family on one for several years. The other thing they can do is, well, I don't recommend it, but there are a lot of people that just go without and rely upon the system, the hospital system that is designed to potentially take care of them. Again, it's based on income. That 400% of poverty is one of the key factors. So we don't recommend that at all. There are short-term policies, but they have strict pre-existing condition clauses, so that's usually not a good idea. So if you're an individual, you actually are pretty limited. For a small business, they need to start thinking a little bit more outside the box. The traditional carriers, again, are kind of restricted by the Affordable Care Act, but there are a lot of new, what I would call forward-thinking plans out there that we work with that can do some amazing things.
How bad do you think the cost of insurance premiums is getting? Do you think this is a huge jump this year? Describe the percentage, and do you think that we're getting toward a breaking point?
Yeah, well, the breaking point is inevitable at this point. When we're seeing, like, we have a group that's nice size, 34 employees, fabricating company. They have to go on an Affordable Care Act group plan because of some pre-existing conditions in the group. They're looking at a 19% increase. How can they afford to not pass that on to their customers ultimately? And, what does that do to their business if the customer suddenly is supposed to pay 15-20% more for their product?
Ouch, that's a lot.
Yeah, it's not good.
Well, John, thank you so much for always sharing your expertise on this. I know this is your wheelhouse, and a lot of people are looking at their coverage right now, especially on the heels of the government shutdown ending. So I think a lot of people are paying close attention to this. Thank you for being here.
Thank you.